says, hi, the clinician would like to talk to you. I'm going to assume that it's a master's or PhD level individual in behavioral health that's involved in the team, right? So usually clinician is geared towards the individual that's doing the therapy, right, on the team.
Okay. Now, social workers.
Okay.
What is a social worker, and is there a difference between a social worker and a clinical social worker?
Right, so the degrees are licensed clinical social worker, right? And there are social workers that focus on a pathway for more clinical therapeutic intervention too. So social worker means that they did a lot of the training that a licensed therapist, like an LPC, a licensed professional therapist, meaning a master's level type of care. But social workers also learn sort of the unique way to do what's called case management and care planning and disposition planning for people that are in the hospital. So social workers really know the intricacies of available resources in the community, discharge planning for patients at hospitals, things like that. So social workers have that sort of specialty under their belt as well.
Interesting.
Yeah, I like that. So, okay, hold on. He brought up a few here. Let's continue our list here, then we'll talk about it. So he first he talked about just general master's level therapists. The first one that I'm gonna put on here is an LPC. Stands for has different has different meanings depending on the state. The designation is different, but licensed professional counselor is typically like the most plain Jane white bread therapist, master's level therapist, and so that'll work. They are your quintessential people of when most people say I go see a therapist. That's usually what they're talking about. 2-year degree. You do it after your undergraduate degree. It's a professional program. You know, you see clients for a couple hundred hours, and then you graduate, and then you work in usually like a therapy office, or sometimes even in, say, a psych hospital. So in like inpatient psych hospitals, we had a mixture of psychiatrists that were usually managing medication, and then the people that were actually doing therapy sessions were typically the LPCs, the licensed professional counselors. Sometimes in addition to that, we would also have a licensed clinical social worker who was also doing case management for the individual. Say they were like homeless and they ended up inside the psych hospital for whatever reason. Or I've worked in kids psych hospitals before. It's really sad sometimes, honestly, the stories. I think the youngest patient that I've ever worked with in a kids psych hospital was like 4 years old, and he was institutionalized in an inpatient psych hospital. It's pretty heartbreaking. But yeah, so for those individuals, especially children, especially like minors, if there's stuff going on in the home, a lot of times they're working with like a licensed clinical social worker, which is our next thing to talk about here. Let's see. Well, I might have to, let's just say social worker. We'll just call it that. So a licensed clinical social worker, like you said, is really, I actually almost went to school to become one of these because they're so like holistic. Clinical. I am struggling to spell here. There we go. We got it, y'all. They're really interesting in that they're very holistic, in that they really work with an entire like individual. They work with your mental health status, but then they also look at stuff like, are you, food, clothing, or housing insecure? Which a lot of times if you go see a therapist, they'll kind of not understand how big a role that a person's ability to meet their basic needs really affects their mental health, right? So if you're housing insecure, what is that going to do to your mental health? What can we do to help, you get more secure in your basic needs like housing so that you can be a little bit more mentally and emotionally stable? All of that stuff, and all that stuff kind of generally falls under the umbrella term of case management, which I've been a case manager before. So I've worked with people out in the community to help them get access to like food, clothing, shelter, work with people that are unfortunately bouncing between shelters, like they were actually homeless. Those really suck. just because the system sometimes is not really well equipped to help people in those situations. So if you can afford like $150 an hour to go see like a licensed professional counselor, usually life is going pretty good for you. But oftentimes, if you're someone that's seeing like a licensed clinical social worker and they're doing case management, there's just like a whole life overhaul that we need to do on this human being. Like maybe they don't have a job, maybe they're homeless, maybe they're dealing with substance abuse issues, you know, food insecure, that sort of thing. That's not always necessarily the case. A licensed clinical social worker is not always necessarily doing case management. Sometimes, or oftentimes, you will see licensed clinical social workers also just doing normal therapy. So yeah, sometimes these guys can kind of float all over the place. You'll see them all over the place doing a variety of things. So it's a really versatile degree, if nothing else.
Now, between psychologist, counselor, clinician, therapist, clinical social worker, and licensed
professional counselor, LPC.
An LPC. Are there any other assessment
Bingo.
and therapy providers that we're missing out of that group?
Well, I think
There will
you
be
certainly
bingo
have
cards if it's
psychiatrists that
available
can do that for you, and we'll talk about that. You can even have an APN or a nurse practitioner or an NP that provides therapeutic intervention as well. So they can fall under that category too.
Understood.
But I think a good distinction, the way you sort of broke it down was prescribers and non-prescribers, I think is a pretty good way to go because that's the most clear delineation.
So if someone has bipolar disorder, for example, that is something that requires a medication to be treated. They could see any number of the individuals that we discussed, but in addition to that, they would have to see someone who can prescribe medication.
Most likely. I mean, of course, there are circumstances where someone with bipolar disorder can be managed with just psychotherapeutic intervention. But, you know, as you sort of climb the ladder of care or acuity of care, right? And you start with, let's just say, a therapist, which could be, let's just say, a master's in clinical social work or a licensed professional counselor, right? If that counselor feels like, you know what, this looks like a diagnosis of bipolar disorder and it looks like medication would probably help you, then they might refer you to a prescriber.
Okay.
And then that's where we get involved with the team effort that I was talking about. That's very, very important.
Are there any circumstances where a psychologist could prescribe medication?
Yeah.
Okay.
Now, as you know, and as our viewers probably know, it's actually pretty hard to find behavioral health providers in the United States right now. It's a shortage. So there are certain areas of the country.
Before we move on to the thing that he's talking about, medication, he brings up a great point there that typically there's this idea called the acuity of a patient's mental health status, that as they become more acutely mentally ill, so they're dealing with more extreme things, like he mentioned, like bipolar disorder, schizophrenia. God, I've seen all of those things at my time working in the field. You'll typically go see one of those more advanced, specialized professions, like a psychiatrist or a psychologist. If you kind of just someone struggling with anxiety or depression, not to dismiss the seriousness of that at all. Lord knows I've struggled with those things at various points in my life. Thankfully not right now, but you know, as a result of which I've seen master's level therapists before. So yeah, he brings up it's a very good way that he worded it. Typically you'll start off just seeing like a master's level therapist, whether it's a LPC, licensed clinical social worker. We'll talk about marriage and family therapists next. That's my favorite because that's what I was in school for. And then if they're like, hey, I think medication would be good for you, or like, hey, maybe there's something more extreme going on in case of your mental health diagnosis, we really should get this very rigorously diagnosed. Like maybe you've got like borderline personality disorder and you come in because you're struggling with anxiety or depression because one of your relationships just blew up, right? Because that's a pretty typical thing for people who struggle with borderline personality disorder. Therapists might talk to you a little while about your depression and your anxiety. Then after a while, be like, oh, wow, there's all these, characteristic, mood swings and feelings of emptiness, self-harming behaviors, all of these things that are characteristic of a borderline. This person might match that diagnosis. Maybe this is something we want to look into more rigorously, and then they might send you off to someone like a psychologist who's going to really sit down and diagnose you. Or they might send you to a psychiatrist if it's something like schizophrenia, bipolar disorder that really gets a lot of benefit from medication, because certain disorders, the number one treatment intervention is medication.
That have a shortage of prescribers, because we know that medication does help a certain part of the behavioral health community for sure, and we have a shortage of prescribers. So certain states, I believe right now there are about 5 states in certain areas where psychologists can actually prescribe non-controlled substances, meaning medicines for depression and bipolar disorder, for example, but non-addictive medicines, or medicines that aren't considered dangerous by the CDS or DEA.
Okay. Wonderful. That was, I needed that so bad. I've been talking to you and our other doctors and patients.
Pretty good breakdown
and I
of
was
everything,
always just
honestly.
like,
It was a good video.
What is the difference between all of those? That was so clear. Thank you for providing that. In our next session.
So yeah, that's a little bit of a breakdown of the different types of therapists that exist. Now we've got a couple more that I want to introduce here to round things out. So we talked about psychiatrists. Just to summarize: psychiatrists, medical doctors that can prescribe medications; psychologists, they can be either PhDs or PsyDs, and they can focus on research, they can do teaching, and then they can also see patients and do psychotherapy, oftentimes with a real focus on diagnosis. These guys will charge like $1,000 to give you an official diagnosis. It's pretty insane. Licensed professional counselor, that's like your quintessential I go to see a therapist. Social worker, they can do therapy, but they can also do case management as well. A couple more that I want to introduce as we round out our psychotherapist bingo card here. So marriage and family therapists. That's what I was in school for. I was in it was called an MFT program for about a year. And yeah, so they really focus on looking at people's mental health from the lens of a very systems-based approach. So I'm going to look at you, and maybe you're struggling with depression, maybe you're struggling with anxiety, and then I'm going to look at all of the kind of the entire environment around you, but in particular your social connections. So how are relationships with your family? How are relationships with your friends? Are you in a relationship with someone romantic right now? Are you married? Are you divorced? Are you widowed? And then I'm going to kind of understand how your social network will show up to influence your mental health. And there's going to be some mental health, some individual mental health that I'm going to work on if I'm a marriage and family therapist. And then there's also going to be some helping you navigate your relationships to others, right? Sometimes if you're a marriage and family therapist, you'll sit down and actually do couples therapy, but sometimes you'll also just see individuals, or you'll sit down with an entire family. That's always fun. I've haven't actually sat down with entire families before. I've sat down with couples before, and but actually doing full-on therapy it's pretty wild, yo. So marriage and family therapist. I feel like most people don't actually know that like this is what they're looking for. Like most people, if they want to do couples counseling, which I'm curious if anyone in chat has ever like been to couples counseling at all. I know I've been with past partners before, and more than one partner. And so you might see a marriage and family therapist if you go to couples counseling. It's not 100% the other professionals like an LPC or an MF or a licensed clinical social worker will also do, say, couples counseling or family therapy, but an MFT really specializes in working with interpersonal relationships and social systems. So, oops. Let's see, there's that video. Let's see, what else have we not talked about? So in addition to that, those are kind of the quintessential big 5, the main ones that you'll interact with if you go see a therapist. If you get meds, you'll probably see a psychiatrist. If you go to get diagnosed, you'll probably see a psychologist, although master's level therapy clinicians can also diagnose. Oftentimes they'll have to for insurance purposes. That's a whole big long story for another day. But there are some other ones that you might see that are kind of worth mentioning as well. So the next one that I want to talk about is, I'm going to make this like one big huge category. So art / music / recreation therapists. These are people that are kind of cross specialists. And they'll use either art or music or even like recreation. I mean, like when I say recreation, think like recess is therapy. Like I've worked in hospitals before. We have had all of those people on staff. It's pretty cool to see the stuff that they do. Actually, it's really fun therapy. And quite often these people will work specifically in psych hospitals. You don't see them out in the field a lot, or you might see them in like, say, a group home setting, or like a retirement home sometimes, and they'll again use art, music, or recreation in order to do therapeutic activities. Like, hey, let's listen to or pick a song that means something that's really meaningful to you, and let's journal about what the song means to us, that sort of stuff. Or art, like, hey, paint a picture of a time that was really difficult for you, like paint a picture of something really traumatic that happened to you, and then share it with everyone, that sort of stuff. Next in the list is, again, another specialist here, and I'm going to call that an addiction therapist. And the designations can kind of be a little bit different from state to state. But typically an addiction therapist will specifically help with people overcoming substance use disorders. So I've worked in addiction recovery clinics before. We had some actual addiction therapists on staff. I didn't get a chance to meet a lot of them because I typically worked like in the houses and stuff, working with the people that were living there. So people would come in and they'd try to detox from some kind of substance that they were addicted to. Could be alcohol, could be, like actual hard drugs. And they would come in and detox for typically about a month, 28 days. And then they would leave, and they'd be working with like case managers during that time and all that stuff. But addiction therapist really focuses on the overcoming substance abuse disorders. So it's a little bit of a specialized thing. And then addition to that, I'm going to add in a behavioral specialist. So a behavioral specialist, I forget the acronym. I think it's ACAB, Applied Behavioral. I am struggling to remember this. ABA therapist. So an ABA therapist is applied behavioral analyst. And they will oftentimes work with people that are on the spectrum. So it's an actual master's level degree. These guys are actual practicing clinicians, but they really work from a lens of focusing on changing someone's behavior. And most often it's times people with intellectual disabilities, like autism spectrum disorder, that sort of thing. And I guess that's, having autism spectrum disorder doesn't necessarily mean you have an intellectual disability, but yeah, they help kind of with behavioral issues and that sort of thing. So that's a very specific thing too. Typically people who become applied behavioral analysts are, typically they've known someone in their family or had someone in the past that suffered from autism spectrum disorder or some other kind of neurodivergency, and that's how they kind of get into it. It's a very niche world. I haven't worked specifically in that field before, but I've interacted with those professionals before, and it's a very interesting little niche. And then the last one that I would add on to here is just generally a pastoral counselor. So, if you're someone that is very religious, oftentimes pastors will offer counseling. And so obviously they're coming at it from the lens of helping you walk more in line with other religion you prescribe to, and yeah, so that's kind of its own world too. Some universities will specifically offer a degree for this, some will not. So it's a little bit confusing because some, like I say the master's program that I was in a university that was actually a religious school. However, the degree that they offered was marriage and family therapist. It was a marriage and family therapy degree. There was no specific like religious undercurrent, or even it wasn't in the curriculum at all. But there are some often religious schools that offer specifically master's degrees in like pastoral counseling or faith-based counseling, that sort of thing. So if you're someone that prescribes to that sort of thing, and you want a therapist that can really understand your beliefs and kind of help you live more in accordance with God or whatever you prescribe to, then particularly looking into a faith-based or pastoral counselor is often really, really helpful. So yeah, that in a nutshell, I guess we hit a perfect 9 there. So that worked out pretty good. The 9 types of psychotherapists that one might see. So yeah, if y'all are interested in pursuing counseling or pursuing therapy, those two words are used interchangeably, by all means, kind of take a look at these, and yeah, it can help you kind of get an idea of where to get started. Let's see. Ida says, getting late here, gotta go, but hope to catch your next stream. Good night. Awesome. Thank you so much for stopping in. I know it's like super late over where you're at, so I really appreciate it. Have a good night. I'll have to hang out and do some more Stream Raiders with you sometime. Okay. How we doing out there, y'all? Also, I've been trying to mess with my audio. I was having clipping issues the last stream. So if you guys notice any clipping or popping, any weird noises, please let me know, and I will try to fix it. It's been the bane of my existence since getting this new audio set up. Nice. Awesome. Well, good. I've been messing around with stuff. Thank you, Ratataz. Thank you for letting me know. I think I finally got it figured out. So the next thing that we're going to do, so first we spent the first hour or so talking about the best types of therapists for you, depending on what exactly you need. If you need med, psychiatrist, so on and so forth. Now I want to spend a little bit of time, probably about another 30 minutes or so, talking about the types of therapy that exist. So if you go and see, say, a master's level therapist, licensed professional counselor, licensed clinical social worker, or a marriage and family therapist, they're all going to have kind of a different therapeutic approach. This can be really, really, really overwhelming for people to understand. Like, okay, I think I have this, so I need to go see a therapist that specializes in, wait, what now? Like, what do I need to, I think I might have depression. Should I go see CBT or someone who specializes in the DBT, or what is EMDR, OMFG, BBQ? There's too many acronyms. So I really like this video. There's 2 videos. If there's time, we'll watch the second one. If not, we'll just watch this one. I think this video does a great job of breaking down doesn't go into every single type of therapy, which is a shame, but it nails a lot of the very popular types of therapy approaches and what approach would be a good fit for what type of person, if that makes sense. So depending on what you're struggling with, this is the best type of approach. So I really like this video. Also, I need to make sure that's not overwhelmingly loud.
Decision that we have to make is often the most challenging decision that we have to.
Sorry, I listen to everything at like 2x speed on my own time. I always forget I will just start up a video at 2x speed. I'm like, this is fine. And then everyone's like, oh God, why is it going so fast?
Often the most challenging decision that we have to make is commitment. However, if you have already done that and decided to seek help, you are on the right track. And I applaud you on that decision. But now comes the fun part, yet extremely important. And that is making a selection. Now, deciding to seek help is only the first step of your journey to a better mental health. The first question, though, that you have to ask yourself is, what kind of therapy is right for me? And in this video, I will go over 6 common type of therapy and why they might be the right choice for you. Now, first, we have cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is a short-term therapy that is mainly focused on changing how people relate to their thought and how such thoughts affect their behavior. Now, CBT has many known methods such as cognitive therapy or dialectical behavioral therapy and so much more. Now, CBT might be the right choice for you if you are dealing with an anxiety disorder or experiencing panic attack, bipolar disorder, OCD, and phobia. Number 2, OCD.
We're going to stop here. I think when most people think of, I'm going to go and get therapy, they think of CBT, cognitive behavioral therapy. And CBT really focuses on the cognitive behavioral part. CBT really focuses on kind of looking at your thoughts, building awareness of your thoughts, and then understanding how your thoughts influence your feelings and then therefore influence your behavior. And so the thinking behind CBT is, if we can start to analyze your thoughts here, we can start to shift your thoughts. And by changing and removing the toxic negative thoughts, by shifting and changing the toxic negative thoughts and challenging those negative thoughts, we can begin to relieve some of the feelings of anxiety and depression and stress, or OCD, like you mentioned, because oftentimes people with OCD experience extreme amounts of anxiety from like irrational beliefs and thoughts of like, oh, if I don't check that my oven is off 20 times, my house is going to burn down, right? In starting to challenge some of those thoughts, we can kind of change the feelings that are evoked from them. So if you've got depression because you're like, I'm ugly, everybody hates me, I'll never be good enough, yada, 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 you can start to challenge some of those thoughts and be like, oh no, but a lot of people like me, and I did really good on that math test yesterday, and I'm doing really good at work. And then in doing that, you can relieve some of those feelings of sadness, anxiety, or whatever, and then you'll get kind of this virtuous cycle of now you're not feeling depressed, and so you go out and you live better in your day-to-day life, which then gives you more evidence of like, oh yeah, actually my life isn't that bad, which then reinforces more positive thought, makes you feel better, and then you go out and take even more positive action. So the work of CBT often is to be that first little push to get you to kind of move in a positive direction, and then your life kind of tends to spiral upward from there. But if you're kind of stuck in a rut, mentally speaking, that can be really hard, right? If you're someone that really struggles with depression or anxiety, if like, oh, I'm getting older now, and I haven't found the one, and I'm not married yet, and what's going to happen to me? Or I lost my job and I'll never find another one, and I'm worthless, and why would anybody ever want to hire me? And that sort of thought. Staying in a rut like that can be a way that we often will spiral down into depression. So CBT really helps with that. So it's really good for all of these things here.
And phobia. Number 2 in our list is dialectical behavioral therapy.
Yo, DBT.
Now, dialectical behavioral therapy, or DBT, is a comprehensive type of cognitive therapy, and it is there to help you learn problem-solving technique and strategies. Now, DBT might be a good choice for you if another type of therapy has not yet worked for you. And this type of therapy is mainly used to treat issues such as self-harm, eating disorder, borderline personality disorder, destructive thought pattern, and so much more.
And so DBT, like you said, DBT is often really helpful for people who don't necessarily respond to CBT. So I've been pretty public about it on this stream. I've been in and out of therapy for about a total of 10 years. I first went to therapy when I was about 23. Saw my first therapist then. Back then, many, many years ago, it was actually for an eating disorder. But Lord knows I've had a lot of things come up over the years. And I often haven't found CBT to be really helpful for me. Some of the skills like cognitive processing skills and